Hi, this is Dr. Honey Wang from the University of York in the UK. As a team of Emirate, we have been studying the relationship between the type 2 diabetes and the severe mental illness, the SMI, such as schizophrenia and bipolar disorder. Here is the summary of the study on resource use and cost for people with type 2 diabetes and SMI in England. Generally speaking, in the UK, around 60,000 people have both conditions, and these two conditions are likely to interact with each other and make people more likely to have poor health outcomes and require more complex care pathway. Despite all this, little is known about the healthcare resource use and the cost for people with both conditions. Therefore, the aim of these studies are to first assess the impact of SMI on cost and resource use, and second, we want to explore the cost predictors and the lifetime cost, so that we can have a better idea about how to reduce the cost and improve health outcomes. So what we did is we used the CPRD data to identify the people with both conditions, and that is group A. And then we matched the age, gender, and the primary practice with a ratio of 1:4 to people with type 2 diabetes alone, and that is group B. Finally, we link these two groups to CPRD and HES data for the primary and secondary care information. So overall, we have identified 1,620 people with both conditions and 4,763 people with type 2 diabetes alone. They account for over 1 million primary care contacts and more than 22,000 hospital admissions. After the analysis, the result shows that, on average, people with both conditions did cost £1,930 more every year, and this is mainly driven by number of non-mental health-related hospital admissions. Therefore, the impact of SMI is confirmed. Next, we look into people with both conditions. The result shows that for those who are older, have more comorbidities, take antidepressants, and live with both conditions longer are more likely to have a higher total cost. We also found that the expected lifetime cost was around £35,000 per person, and they would generate a total cost of £250 million to the NHS every year. So the conclusion is that people with both conditions did incur higher cost. To reduce the cost and improve the health outcomes, we should first have a more proactive and coordinated care, especially for those who are older and have more comorbidities. Second, we should develop the strategy to delay onset type 2 diabetes to help people reduce the need for non-mental health related admissions. For more information, please refer to the paper published on the British Journal of Psychiatry.